So it's summertime, time to look your best. I'm Dr. Galvin, and I'm here today to talk to you about Botox. The first thing you want to do is to make sure the person that you choose for this has ample background in the subject matter and has a lot of experience actually hands-on treating people. What is Botox? It's a neurotoxin. It was first started being used in the 1970s by eye doctors for eye spasms, eye muscle spasms. It is a paralytic, right? It affects the receptors of the nerves to temporarily paralyze it. Botox is also a toxin. It's called botulinum toxin. We safely use very minute quantities for aesthetic purposes. When I meet a person, the first thing I do like to ask, what bothers you? How would you like me to proceed? Tell me what you see and what bothers you.
I really want to correct the crow's feet.
You have to understand the muscles of the face. This is a graphic I like to show the patient. This is also what I use to mark on it the lot, the expiration date, how many units we use in each area. It's good for the patient to understand why I'm doing what I'm doing. Well, as you can see, Kevin, we'll start with the crow's feet. The orbicularis oculi is a muscle that's actually round. So when you smile, yeah, you can see how it goes up in a curve, actually, curved area. So I'm going to go ahead and approach you in a couple of spots all the way around. If I were to just inject her forehead without offsetting it in the glabellar muscles, she would get a drop and this would happen. Not a good look. So when we paralyze that muscle, she's gonna get a nice lift so we can see her pretty eyes better. One must always inject the glabella if you are going to do the frontalis. This will offset the downward going forehead or frontalis muscle after it's injected. This is a partnership. I have to have her or him look in the mirror as we progress and say, don't you think I need a little bit more here or here? I get your feedback.
How long would it last?
On average, 3 months. For younger people, seems to last longer. How active are you? This is a biofeedback treatment. Once you start receiving the treatment in your forehead, you're going to stop doing that. Because when you go to make that movement, you're used to it not moving, and you'll think about Botox and you'll stop the movement. I normally have you come back a week later and see if there's anything you need. And at about 2.5 months, before you totally lose product, I'll treat you again, and that way it'll last for another 3 months without using as much product. The questions to ask the practitioner are, do you dilute your product? How much normal saline do you put in? The recommended dose per Allergan, they recommend 2.5 mLs of normal saline for a full bottle of 100 units of Botox. I hope this helps you to be informed and educated before you go out and get it done.
What about getting an allergic reaction or something?
20 years, I've never had an allergic reaction to Botox. We can always do a test spot. Let's not treat you today. Let's do a little test spot and you watch it and I'll watch it and we'll keep track of it.
Is there any bruising or what's the side effects?
Right. I cannot guarantee that you won't get bruised. There's ways to get around that, and the injector, again, needs the experience in order to not bruise you. Males look good when they still have movement in their face, so I don't want to make him so that he has no movement at all. 10 units on each side, and then I'll do 10 units in the procerus, this area, which will give him a nice little lift here. I'm going to do a smattering, a very light effect on his frontalis muscle. This takes 24 hours to 7 days to kick in, to have an effect. So over the next few days, you look in the mirror and you'll see the progressive paralyzation of some of these areas that bother him, the wrinkles on his face. And for today, no lying down for 4 hours after you get a treatment, because the product can drift. So that's pretty much it. You don't want to exercise profusely, sweat, stay in the sun, because you will dissipate the product that we've just put in. So today is a chillax day, relax, and there's nothing you need to do, because it's been done, and it's just time to relax and let it set in. I'd love you to come in and have a free consultation. Don't be shy. We have a promotion going on to come in and be fresh and refreshed with Botox. Family Integrative Medicine.